had some concerns about getting turnout and considering it's happened so quickly, and also considering that CarePoint and Cape they declined their invitation to speak tonight.
So, if you drive by Greenville Hospital now, you'll see that it's under construction. Big sign on the outside saying coming soon. We are actually moving all of the services that we currently provide on Garfield Avenue over to the Greenville Hospital once the construction is complete. We anticipate probably by I want to say September, because if it opens sooner, it will be that much better, but knowing how things work with construction, I'm sure by September 1st we'll have a new facility over there. We're also going to provide a urgent care ambulatory center over there. We're trying to get it licensed as an emergency department, but it will probably be an urgent care center when we open it first. It'll provide a whole host of ambulatory services for the Greenville community. It'll be open into the evening hours to make sure that we are available to serve the community. I think a lot of that depends on the financial impact of moving the EMS service. Already this year, we're going to lose $3.9 million for the subsidy from the city, number one. The Affordable Care Act takes a look at hospitals like ours that serve what's called a disproportionate share of patients who are either Medicaid or charity care. We get special funding for that. Now, the Affordable Care Act is supposed to get more people insured. Well, because people are not getting insured, and because people aren't signing up for health insurance, we're not seeing the impact of more insured patients, and yet we're still supposed to have these significant cuts in Medicare and Medicaid because we have people that we get the special funding for. Those combined with what we believe will be a $5 million hit to our bottom line from moving patients to CarePoint hospitals through this EMS contract, it's going to be very difficult for us to continue to sustain a lot of the community services that we provide. Paul's our CFO. He explains it better.
There are a couple of issues that we can talk about Aetna specifically. When you have a situation with a managed care provider, in our case Aetna, where you try to negotiate rates for 2 years and they fail to come forward with rates that make sense, we didn't have any alternative but to cancel that agreement. That's different from the CarePoint hospitals that have decided that their whole strategy, I think except for maybe one payer, which is Horizon Blue Cross, where they're out of network with all of their payers. So the way they get paid a higher amount of money is to bring all of those patients in through the emergency room. There's a quirk in the law that says if you bring a patient in through the emergency room, you're not paid a standard rate or a contracted rate. You're paid on your charges. And for those of you that have been following the newspapers, you know that the CarePoint hospitals have some of the highest charges, not only in the state, but in the country. Bayonne and Hoboken are in that realm. As is the hospital, the old Meadowlands Hospital in Secaucus is up there as well. So in our case, we have contracts with the managed care payers that say, if you come into our hospital, whether it's in the emergency room or not in the emergency room, we know exactly what we're going to be paid. And that's a contracted rate. When you're out of network, it doesn't work that way. And that's how they make a lot of money. So the difference is you have a contract, you know what you're going to get paid, it's much less than your charges. If you're out of network, you get paid at a higher amount. But the catch is everybody has to come in through the ER.
If I were to go out of network and cancel all of our contracts, the bottom line for the medical center would be $100 million. Very easily. Very, very easy for us to make that kind of money. But that doesn't meet the mission of our hospital to serve our community, and that's why we don't do it. We've had this discussion with our board. We've had a significant amount of discussion about, how important is it for us to really stay in network. And we believe that we serve the community much better by staying in network and working with the insurance companies to make sure that there's a fair and equitable rate. At the end of the day, with all of this money going to these CarePoint hospitals, insurance premiums in Hudson County, I guarantee you, are going through the roof. All right? Because that money's got to come from somewhere.
The state legislature has just Councilor Vitale has just introduced a bill into the state legislature that would address some of the problems to help coordinate emergency response time in the state, to coordinate care between emergency vessels, emergency services, and hospitals. And the main concern was that it had off major problems such as for-profit ambulance squads taking patients to an inappropriate hospital due to financial incentives. So there's a real concern. This has gone down, made it down to Trenton, that it's a real problem that, you know, there are misalignments of what really we are doing, and that providing care for patients is number one, and not because of making money and the financial windfall that we bring.
So the medical center is not for profit. We have a volunteer board of trustees. We take the money that we make at the end of the year and pour that back into providing facilities for our community. So the Greenville Hospital, the renovation of Greenville Hospital, and the lease back and the buying of all that equipment, that comes from the profits at Jersey City Medical Center. At the end of the day, that's where that money goes. In any facility that we have, the money gets poured back into supporting the community and the healthcare infrastructure in Jersey City. The for-profits are usually owned by investors, and they pay dividends and taxes. So they've got to pay dividends to their investors, and they have to pay taxes before they can turn around and invest back into the community. For-profit healthcare in the United States has been going on for many, many years. A lot of people think that hospitals in particular should be not-for-profit because having an incentive to pay investors first sometimes misaligns the real mission of what you're trying to do in supporting people's health.
There are a lot of services that are provided by the EMS department that are included in the request for proposal. These range across the spectrum. Everything from community outreach and education. We run the county's only EMT training program, meaning that we train individuals from the community that want to become emergency medical technicians. We run the county's only paramedic training program, meaning we train individuals that want to become paramedics. We actually are working on a program where Jersey City public school students could attend an EMT program through the medical center and then be provided with employment after completing the training. Once someone is employed at the Jersey City Medical Center, they're eligible for what we call our Fast Track program, which allows them to be trained as paramedics, which is a higher level of care at no cost to the employee. And so it truly is a mobile emergency room. As a matter of fact, the state designated term is mobile intensive care unit. These individuals have thousands of hours of training. They're able to start IV lines, put in breathing tubes. They carry over 42 different types of life-saving medication. It truly is a mobile emergency room that goes out. So that is something that we provide that no one else in the county provides. There's a number of systems that we've implemented on our own accord in order to try to improve care. You know, from our standpoint, you look at what does the provider include that goes beyond transportation, whether it's education, whether it's being the state designated medical command center. We coordinate all of the healthcare in times of disaster for making sure that there's enough beds in different hospitals, making sure that, God forbid, something were to happen here in Hudson County, we have someone in our facility whose full-time job is to make sure that there's enough beds in the county for these patients, and then work with other hospitals to make sure that we can find places to put people and work with nursing homes and things like that. And of course, we certainly, I think if you look at, even if you look at the data that came out, if you look at the way that the proposal was scored by the evaluators, on every single quality measure, we outscored the competition. And for us, that really speaks volumes for us. And we're truly proud of the fact that it's about quality, and it's about healthcare, and it's about taking care of people. 40 years ago or 30 years ago, EMS or ambulances was about putting somebody in an ambulance, which back in those days may have even been a hearse. If it was run by a funeral home or something like that, they put them in the back, two people got in the front seat, no care was provided, and they drove them to the hospital. EMS is different now. EMS is bringing the healthcare to the patient. It's mobile emergency rooms. It's real, true things that can save somebody's life at their home. The national average is somewhere in the range of 9 minutes. Generally what they consider, if you talk to industry experts, is that they expect an ambulance in an urban environment to be able to be on scene 8 minutes and 45, 9 minutes, somewhere in that range. Our average response time is somewhere around 6 minutes. Recently, we've been hovering around 5 minutes and 45 seconds. But we say 6 minutes, occasionally it's a little bit higher than that. Just answer to that. We've done it, and we have the data to prove it. Our response time was 9 minutes in 2006 before we implemented this predictive model. We were even surprised by how effective it was. And we knew we needed to be more efficient, which is why we originally went into this. We had to figure out how we could be better at what we did. And we saw a dramatic reduction very quickly to our average response time of about 6 minutes, as I had said. But we didn't necessarily, and I'm going to be honest, anticipate what was going to come with that, which was the survivability for cardiac arrest. We knew things were going to get better. But when we suddenly saw a cardiac arrest resuscitation rate, which was 17%, immediately jump up to 33, and then 40, and now 50% of patients, when the national average is only 17%, we knew that's what we did, and that's what came out of it. And we actually took time and sat down with students from the Mount Sinai School of Medicine, and they took our data and were able to statistically prove the correlation between response times and survivability.
These are mobile intensive care units with the most sophisticated, advanced technology. When we get to the scene of where a patient, let's say, has had a heart attack, we're starting the resuscitation immediately.
We bid on the contract that we do it for the term of the contract, which I think was a 3-year with what, two 1-year options. Medical center is doing better financially. The collections for even EMS over the past 5 years have gotten better also. As the city continues to grow, we see more people, as more people sign up for Obamacare, then that's billings that we can get through the EMS service that offset the expense of providing the service. That's how that works.
So what I'll start off is, anytime someone someone calls an ambulance, there's a couple different things that we look at. The most important thing we look at is what we call the acuity of the patient, or how severely ill are they. And we want to know if there's something special that they need. So, for example, the medical center is, as we said, what we call, it's all of the really high-level services in this county are provided at the medical center. So if this is a trauma patient, the medical center is the only facility in the county that can handle that care. For those lower-level calls that just need to go to any hospital, we certainly will take patients anywhere that they want to go. One of the misnomers that's out there, one of the misconceptions is, people have asked, particularly some people in this section of town, why we don't take patients to Bayonne Medical Center. Well, the contract that we have with the city of Jersey City, the request for proposals that they put out back in 2008, required us, by contract, to only take patients to Jersey City hospitals. And so when we had an issue that came up and it got a little bit of press a few years ago, we wanted to make sure that we could say with absolute certainty that we weren't securing patients. And so we implemented a system, again, more technology, into our ambulances, so that every time we have a patient, our EMS providers can then hit a button on our computers, and every ambulance has a computer in the front before they take someone to the hospital. And it simply says, something along the line of, I'm taking a patient to the hospital, and it notifies the dispatcher of that. But as soon as they hit that button, it asks the provider, what kind of a hospital do you need to go to? Do you need to go to a cardiac hospital? Do you need to go to a stroke hospital? Do you need to go to a trauma center? Do you need to go to a general hospital? And once they pick that, it immediately tells them the closest hospital for you to take this patient to is whatever hospital it is. And our crews use that as guidance to tell them where it is that they should be taking their patients.
I think, look, this mayor and the council, I think, campaigned on listening to the voice of the people in the community. And so the more that they hear from you about how important an issue this is to you and to the safety of the residents in Jersey City, the more I think we can sway this decision. I think this is one of the most critical safety issues to hit our city in a long time. I think it means the difference between life and death for many people. It's a critically important issue. Get the word out. I think the more that we tell people that, look, this is a huge issue for our city and will make a difference in people's lives, and I think the more that you get that out to your council people and to the mayor, I think the better off we're all. I would just like to thank everybody for coming out tonight. It's been both nights. I know this is an important issue. I thank you for your attention, for your great questions. I think those are all great questions. Get out there and let everybody know what's going on, and keep the good fight out.